When I first joined ORM, it was right at the time that the Pinnacle transition was happening. And when I joined, a lot of the staff were having to stay late to finish up patient care, and the morale suffered. Since the Pinnacle transition, we've made a lot of changes, restructuring the staff, switching EMRs, implementing the navigator model. And in that time, there's been a lot of improvement in efficiency in the office. When I leave the office at 5 after my office visits are done, most of the staff is leaving at the same time. And I think they come back feeling refreshed and rejuvenated and ready to take on another day.
We now feel like we are not in a silo. We can connect with anybody in the Pinnacle network, whereas before we felt like we couldn't ask the question because of proprietary information. There was not a lot of sharing that happened. And at least from my standpoint as a quality manager, being able to reach out to all sources within the Pinnacle network has changed our practice.
Since joining the Pinnacle network, we have had an increased sense of collaboration here at the local level, which has been really nice in terms of being able to talk with other practice leaders, other clinicians about best practices, about protocols, and really working to serve our patients as best as possible.
ORM's grown rapidly over the last 10 years, and with growth comes challenges to processes within the complex teams. We've been struggling to maintain a level of personalised care that we were known for in the IVF community. Joining the Pinnacle network has given our clinical teams tools to return to the high-touch care that our patients expect.
Pinnacle really transformed our ability to collect data, to connect with the patients in more meaningful ways, and also help the staff be as productive as possible without spinning their wheels.
Our new structure has really allowed Heather and I to closely manage our team of navigators, which has been really fruitful for us and for our patients' experience overall.
Co-managing the teams, we've realized that there's a lot of inefficiencies that we have corrected. We've been able to make sure that the team knows what's expected of them. The patient care has gone up. We've been able to really identify different milestones for patient care, all the way from new patient process all the way through the graduation.
One of the other benefits to joining a network is actually having colleagues throughout the country that you can reach out to for clinical advice if there's a really challenging case, adopting dot phrases and note templates for your EMR, sending patients to for monitoring, or if a patient relocates, knowing a doctor who can take care of them. That this is all done in a very collaborative, not a competitive way.
As a physician within the Pinnacle Fertility Network, I collaborate with several other physicians who are also in the network, and it has been a really nice resource for collaboration and sharing of information and advice on challenging patients and suggestions of which direction to go in next for a future cycle. And I really think it has improved the quality of care that I can provide to my patients.
As the world changes, we couldn't do this on our own. It's too busy. There's too many changes all at once. And so we're glad to have collaboration and connection to a larger organization so that we can go about our daily business of helping people have their families, but realize that all of the other things about creating a modern company that is able to be efficient and innovative at the same time, that those things are happening at the Pinnacle level, while we at the individual level improve the everyday care that we give with every appointment and every ultrasound for our patients.